More local coverage at 6. We told you last night how a local ambulance company would be adding to its fleet after being unable to respond to emergencies recently.
But as First News senior reporter Jerry Ricciuti tells us, problems with response times and availability aren't just limited to here in the valley.
Firefighters in Poland started running their own ambulance a year ago, looking to fill in when AMR didn't have crews available.
We thought it would be 3 or 4 times a month. We're transported on average once a day.
Since then, the department has seen about 700 runs and plans to add a second ambulance.
We have to fill that void, and a lot of other communities who aren't prepared to do that are going to have issues.
COMSTOCK says the nation is facing a worsening shortage of paramedics. The issue came to a head locally this week when AMR couldn't respond to a water rescue near McKelvey Lake. COMSTOCK blames at least part of the problem on cuts to Medicaid and Medicare reimbursements.
It's hard for whether it's private or public entities to make money. It's hard to pay paramedics for the services that they provide.
This week, AMR executives agreed to add 2 more ambulances to the local fleet, which covers Youngstown, Poland, and Lowellville.
They're very cognizant of our concerns and our problem, and I think they're trying to work to alleviate that problem, but it's not easy.
But some communities are moving away from private companies. The Cardinal Joint District in Canfield started its own service 2 years ago, adding brand new ambulances. Since then, the department's had almost 1,600 runs with them.
Communities have to decide what level of service they want. For increased level of service, they have to be willing to pay for it. It doesn't come free.
Although AMR executives have not returned our calls, the city's law director is calling the additional crews a step in the right direction.
And we hope that bringing light to this circumstance brings even more focus and more relief.
Jerry Ricciuti, WKBN 27 First News.